In emergency situations, every second counts. Knowing accurate first aid can be the difference between life and death. It empowers individuals to provide immediate care, potentially minimizing injuries and improving outcomes. However, many misconceptions about first aid exist. These myths can be harmful and even worsen the situation. It is crucial to dispel these myths and equip ourselves with the correct knowledge. In this essay, we will debunk common first aid myths and outline the appropriate practices. Always remember that seeking professional medical help is paramount in any emergency. Understanding the principles of first aid is not just for medical professionals, it is a responsibility for everyone. By equipping ourselves with accurate information, we can become more confident and effective in responding to emergencies. Let's delve into some prevalent first aid myths and separate fact from fiction. Myth 1. To remove a foreign object from the eye, lift the eyelid and blow on it. Fact: never attempt to remove anything from the eye except for maybe an eyelash. Blowing on the eye can introduce more debris and cause further irritation. If it's an eyelash, wash your hands, locate it in a mirror and gently remove it with a wet cloth. For anything else, seek immediate medical attention. Myth 2. Apply ointment to a wound to speed up healing. Fact: ointments can trap moisture, creating a breeding ground for bacteria. Instead, wash the wound with cool water and mild soap. Pat it dry and cover with a sterile bandage. Myth 3. Rubbing alcohol or vinegar on the skin can help reduce fever. Fact: this is a dangerous myth. Alcohol can be absorbed through the skin and is harmful to children. Vinegar can irritate the skin and increase acidity levels. The best way to manage a fever is to drink fluids and keep the room cool. Consult a doctor if the fever persists. Myth 4. If someone faints, sprinkle cold water on their face or lift their head up. In fact, these actions can worsen the situation. Sprinkling cold water can startle the person and lifting their head can restrict blood flow. Instead, loosen tight clothing, lay them down and elevate their legs. Once they regain consciousness, let them sit up slowly. Myth 5. Apply butter or sour cream to a burn to soothe the pain. Fact: while butter and sour cream may temporarily relieve pain due to their coolness, they can actually trap heat and worsen the burn. The best course of action is to run cool water over the burn for at least 15 minutes. Do not apply ice directly as it can damage the skin. Cover the burn loosely with a sterile bandage and seek medical attention. Myth 6. It's okay to try and set a broken bone or dislocated joint. Fact: never attempt to manipulate a broken bone or dislocated joint. Doing so can cause further injury and pain. Instead, immobilize the injured area using a splint or sling and seek immediate medical attention. Myth 7. Apply heat to a sprain to reduce swelling. Fact: heat can actually increase blood flow to the area, potentially worsening the swelling. For the first 48 hours, use cold compresses to reduce inflammation. Apply the compress for 20 minutes at a time with breaks in between. Myth 8. Induce vomiting immediately if you suspect someone has been poisoned. Fact: inducing vomiting should only be done under the guidance of a medical professional. It can be harmful in certain cases. The best course of action is to call emergency services immediately and provide them with as much information as possible about the ingested substance. Section 4. Debunking common first aid myths. Part 3. Myth 9. To rescue a drowning person, always approach them from the front. Fact: it's safer to approach a drowning person from behind. They are often panicked and may instinctively grab onto anything in reach. Approaching from behind allows you to secure them under the armpits or chin and tow them to safety while keeping their head above water. Myth 10. It's okay to try and remove an embedded object. Fact: removing an embedded object can cause further damage and bleeding. Control any bleeding around the object and seek immediate medical attention. Myth 11. Apply ice directly to the skin to reduce swelling. Fact: applying ice directly to the skin can cause frostbite. Always wrap the ice pack in a thin cloth before applying it to the affected area. Limit ice application to 20 minutes at a time, followed by a 90-minute break. Myth 12. Superglue is a suitable alternative to stitches for deep wounds. Fact: while superglue can be used for minor cuts, it should never be used on deep wounds. Deep wounds require professional medical attention and may need stitches or other interventions to heal properly. Section 5. The importance of continued learning. In conclusion, understanding accurate first aid practices is crucial for everyone. Debunking common myths and replacing them with evidence-based knowledge can mean the difference between a positive outcome and a potentially life-threatening situation. Remember, while this essay provided insights into various first aid practices, it is not a substitute for professional training. Consider enrolling in a first aid course to gain hands-on experience and enhance your ability to respond effectively in emergencies. By taking the time to learn and stay informed about first aid, we can all play a vital role in ensuring the safety and well-being of ourselves and those around us.